Aphorism 159. The smaller the dose of the homeopathic remedy is in the treatment of acute diseases, so much the slighter and shortest is this apparent increase of the disease during the first hours. Explanation. In this aphorism, Dr. Heinemann has given idea about smaller dose. If dose of homeopathic remedy is smaller than the apparent increase of the disease during the first hours in the treatment of acute disease will be much slighter and shorter. Due to smallness of the dose of remedy, the initial aggravation will be much slighter and shorter. Aphorism 160. But as the dose of a homeopathic remedy can scarcely ever be made so small that it shall not be able to relieve, overpower, indeed completely cure and annihilate the uncomplicated natural disease of not long standing that is analogous to it. Aphorism 249. Note: we can understand why a dose of an appropriate homeopathic medicine, not the very smallest possible, does always during the first hour after its ingestion produce a perceptible homeopathic aggravation of this kind. Explanation. In this aphorism, Dr. Hahnemann has given idea about effects of smaller dose. But if the dose of remedy is so small, smaller than required, then it will not be able to relieve the sufferings of the patient. If the dose of remedy, if suitable, which can overpower the natural disease, there will be complete cure and it can annihilate the uncomplicated natural diseases of not long standing, which is similar to the remedial disease. Aphorism 249. Note. So here we can understand why a dose of an appropriate homeopathic medicine, which is not too smallest, it produces perceptible homeopathic aggravation during the first hours of its ingestion. Here the dose should be selected smallest possible, but it should have potentially to overpower the natural disease. It should produce the artificial similar disease stronger than the original natural disease. Footnote 110. These exaltations of the medicinal symptoms over those disease symptoms analogous to them, which looks like an aggravation, has been observed by other physicians also, when by accident they employed a homeopathic remedy. When a patient suffering from each complains of an increase of the eruption after sulfur, his physician, who knows not the cause of this, consoles him with a assurance that the itch must first come out properly before it can be cured. He knows not, however, that this is a sulfur eruption that assumes the appearance of an increase of the itch. The facial eruption, which the viola tricolor cured, was aggravated by it at the commencement of its action.